one set of ice without reflection, then we'll do another set of ice, the same set of ice with reflection, just so you can see the differences of what we're trying to say. So, Jade, you're going to be the patient. What do you want to have? Like, what do you want to have?
Do you want to do?
Headache, back pain, depression, whatever, yeah?
Headache.
Okay, fine. So a young person comes with a headache for, I don't know, let's say 2 months, on and off. I've done a clinical history, I've got an idea in my mind what's going on, I'm thinking maybe tension headache, possibly maybe migraine, but I want to find out a bit about Jade's mind. Like, what does she think about this? But I don't want to do it in a way that sounds like I'm doing it for tick boxing, let's get I, C, and E done. I want to make it in a way that the patient feels like I'm doing this for a reason. Okay, so I'm going to do it without reflection first. Okay? So Jade, you mentioned that you've had these headaches for a while now. What was going through your mind with all of this?
Well, obviously, like I said, I was under stress with the new job, so I thought maybe it could be that, but it pretty much just put it down to that.
Okay. And was there anything maybe that was worrying you about all of this at all?
Well, I put it into the internet, put it into Google, and it came up as like brain tumours, or brain cancer, which is why I put off. I didn't even say a lot, I'm just worried.
Okay, fine. Was there anything maybe that you thought when you came in today that we could do for all of this?
Well, I think I definitely need to have a scan or something of my brain, don't I, to check whether that's the case.
Okay, and then I move on. Okay, so I've got 3 questions out the way, I got 3 answers, I'm thinking I did my eyes, sounded really nice, I wasn't rude with her, and I'd move on to something else now, thinking that I've got this right. Okay, now let's try and do it with a bit of reflection instead. So Jade, you mentioned this had been going on for a while now. I mean, what kind of things have been going through your mind about all of this?
Well, I was thinking maybe stress, like I said, like with the new job. I'm under stress, so I thought maybe it could be linked, but I don't know.
Yeah, I mean, fair enough. I mean, stress, yeah, can be linked with headache. And you mentioned work stress, so we'll talk about that in a short while. It sounds like something's changed recently, but you're right, it can be that, but other things can cause it as well. I mean, obviously you've taken the time out to come and see us, so things are going through your minds. Is there anything particularly worrying you about all of this at the moment?
Well, I can Google my symptoms, and the top thing that was coming up was like brain tumours, brain cancers. So you know, that's why I was just scared to come in, because that's what we saw I had.
Yeah, I mean, firstly, a lot of people Google their symptoms, and there's a lot of things on there that does scare people. And tumours, you're right, can be a cause of headache. It's very rare, but you know, once we've had a chat through things, we can certainly come back to that. Because I can see it's been on your mind. And right, you say. And obviously, you've tried a few things. You mentioned painkillers and things like that. Is there anything in particular you thought that we could do for all of this today when you came?
Well, I think obviously I need like a brain scan or something, don't I, to check whether that's the case.
Okay. Yeah, I mean, again, a reasonable thought. We do sometimes do scans of the brain, like you said, not in all cases, but maybe once you've had a chat, we've examined you, we can see if that's right for you or not. How does that sound?
Okay, fine.
Okay, fine. So, and now you move on. Do you see the difference?
Yes.
Exactly the same 3 questions, exactly the same 3 answers, but it's changed from, let me get this information out of the way to score marks, into, I genuinely want to know what's in your mind, because for me as a clinician, that's really important. I need to reflect that what you're telling me, this may be the first time she's told anybody about this worry about a brain tumor. So if I don't give anything back, and I just move straight to the next question, how's she going to feel? Like, the doctor's not really there for me, they're just going through all these questions for the sake of it. Because when I just give her a comeback that, gosh, I can see why that must be worrying. It's all it takes to show that I genuinely wanted to know that answer. It wasn't that I needed to know it for an exam. And it also gives a bit of comeback that this is something that's been internalized by me, and I'm not just ignored what she said. Remember, reflection is not giving an answer. It's not that, no, this isn't a brain tumor, don't worry. Or, no, you don't need a scan yet. That comes later, that comes in management. When you manage the issue. What I'm doing is reflecting. I can see where that came from. Sometimes we do this, we can chat about that. And that's the difference between reflection and what we call micromanaging. Sometimes people micromanage ICE by giving the answer there and then. No, it's not that, it's this. Or you don't have to worry about that, it's not cancer. That's different. We're not saying micromanage, we're saying just reflect. It enhances your interpersonal skills and makes the patient feel like, do you feel the difference between the two?
Yeah, definitely. As a role player, I felt that you were really listening, you had a reason for asking that. You were going to, not addressing them right there, but okay, you are going to talk about the scan, you are thinking about the scan as you're carrying on, you're not just asked it and kind of dismissed it, decided it was going to.
Great, and that's what we're trying to achieve, and in that time frame. Yeah, so it's still a bubble. When I'm in the bubble, I'm still getting to the end. When I'm in a bubble, I'm not doing I here and C somewhere else and E somewhere else, because that it takes time. I have to remember what have I done, what have I not done. So it's in a bubble, so it's compact, but that little bit of reflection just allows it not to sound doctor-centered.